Nurses Association, New York and New Jersey is bringing over 15 of its experienced nurses to India to help the Tibetan community recover from the pandemic that has left people terrified during its second wave. We will find more about this initiative of Tibetan Nurses Association today from the association's president, Pema Dorjee. Pamela, it's so nice to have you with us today. Welcome to our show.
Tashitele to Sakina and all the viewers for Tibettv TV. I'm so happy to be with you guys.
Tashdile Pamela, and thank you. Pamela, when are the nurses coming to India and how are you planning to carry out the relief work?
The nurses, we all are all ready and they are leaving Friday evening and they will be reaching Delhi by Saturday evening, and by Monday we're hoping they should be in Dharamsala. So it's a big development. We're so excited. We planned so hard for a month. There are a lot of bureaucracies, a lot of fundraisings, but we are able to come up with all the struggles. So it's happening.
So how did you and your team come up with the plan of sending the Tibetan nurses to India, and what is your goal?
In March, May, when second wave started in India, especially all the Tibetan communities in India, like settlement area, northern part of India, so we heard a lot of people were sick. Not only sick, but they're very sick. And whenever we call friends and family back in India, we're hearing so and so died, and these people, we already know them. So if I know 5 people who died, that means there are a lot of other people who know and who died without knowing or without having a data on the government records. So we thought it would be a very good idea to pour in some help in terms of funding or in terms of medical supplies or in terms of actual human resource help. So we have a group chat. It's called WhatsApp group chat for Tibetan Nurses Associations. We've been talking about what is the best way to help them. We raised the fund. We donated to Dharamsala COVID Relief Fund for vaccination and immediate needs. At the same time, we have this another idea saying, oh, how about we can actually go there and help, because we are all professional nurses. We have been trained and to deal with COVID-19 last year in America. So that would be a very good idea to go back to India and help with them and also strategize. Moreover, now the COVID situation is a little better in India, but having said that, there's a high chance, high risk third wave may come. If third wave comes most likely in October or end of September, how shall we deal with it? So that needs to be strategized. So I think it's not only from the government level, also from the professionals and the community level, we should be ready. That's the reason we're sending few nurses from America. So the participants of Nurses America is very interesting. We have nurses from Canada, we have nurses from California, we have nurses from New York. So this program, or project has been initiated by Tibetan Nurses Association of New York, as well as Tibetan Community of Northern California Health Promotion Committee. So it's basically collaboration between these two groups, and mostly funded by Tibet Fund. So we are very happy and thankful for Tibet Fund for providing all these funds to go to India. And also we raise funds from other sides too. You may have questions later about that.
Yeah. So before we talk about the funds, the 15 Tibetan nurses, they have left for India on 18th of June and will be reaching here on the 21st of June. So where are they first going to go and how are they going to be scattered?
So, from the beginning, when we started planning, we thought we're not going to go into small institutions. We're going to help the Department of Health. So Department of Health knows the best way the help is needed. So we will collaborate with Department of Health. We've been collaborating with Department of Health for last 2 weeks. We've been going back and forth with Pandela, Kunsanla, and we know pretty much, we have not seen them, but we know a lot about situation from them. So whatever under the direction of Department of Health, we will go. Right now, it looks like it may be a little tricky or difficult for us to go to South, for being a lot of our nurses have the foreign passport. We may not be able to go to South, but we can definitely visit the northern part and see the community in the northern part area, especially the Dharamsala, Bir, or the Dehradun area, wherever we can reach.
So Pamela, for how long are they planning to stay here?
So our nurses have committed to give us 1 month, exactly 1 month for this voluntary. They may stay more, but the 1 month is mandatory, as we have discussed with our group.
Okay, so Pamela, how did you manage the funds in terms of their traveling and the medical supplies that they will be bringing along with them to India?
So in terms of fund, we are partially funded by Tibet Fund. So we have a chunk of fund from Tibet Fund. We're very thankful to Kong Losang Yindala. He's been providing a lot of funds with not only this time, but also past in other programs with Tibetan Nurses Association. So another chunk is coming from North California Tibetan community fundraising. So Tibetan nurses down there, they did some fundraising for one day and they were able to raise a pretty good money from there. And the third part is we're doing a GoFund page, and a lot of people donated in a GoFund. So we have that. So we have three major sources, and also we have some small private donors here and there. They're calling us and they're donating for us. So it's basically all crowd-funded, and Tibet Fund providing the main support for this project.
So Pamela, do you think that this initiative is going to bring a change in the Tibetan healthcare centers? What are your expectations?
I have a couple of expectations from this program. This program is a project, especially when we send nurses from here to India. So some of our nurses are very, very highly trained. Not only they are registered nurse, but they are ICU nurses. They have the special certification. They have nurse practitioner degrees. They have like some doctor degrees, So they can really, really go deep into the community and see what we can do better. That's one thing I'm really looking into. So if third wave comes, how can we prevent? How can we better prepared for the third wave? Another thing is once we are there for a month and able to show the other healthcare workers how things should be done better. So even if we leave, our knowledge or our experience will be in the community, and it will last for a long time. See what I mean? That's the main reason we have some expectations from these nurses. We want these nurses to go into the community, help individual patients who are very, very sick. Also, use your critical thinking, critical judgment, and see what is really needed in the community if third wave comes. Or in general, in a school or monastery, what could be a better way to be healthy? How infection controls can be done better. How to prevent small infections. I mean, COVID-19 is a big infection, but having said that, we can do a lot better in terms of community levels. So we have bigger expectations, and we have also smaller expectations.
I'm sure, Pamela, there's going to be a lot of positive changes after the nurses come to India, after hearing from you how experienced the nurses are. Anyways, Pamela, can you tell us what other initiatives the Tibetan Nurses Association have been taking during the pandemic?
So as I told you before, this project is being initiated by Tibetan Nurses Association as well as the Tang Health Promotion Community. So both these organizations, and also we have another branch of Tibetan Nurses Association in Minnesota. All these small three healthcare committees or healthcare groups have been working tireless in our community in North America, wherever you go. So in New York, every year we do a lot of health promotions, health assessment, doing Tunga Dujin or any public gathering. We do, public health teachings for elderly population. As we do, also California does that, Minnesota does that. During the COVID-19 last year, Tibetan Nurses Association played a very important key role in dealing with the COVID-19 in the community, not only Tibetan community, but also Himalayan communities. So we have nurses who could speak Hindi, who could speak Nepali, who can speak English, Tibetan, everything. So last year, New York was the epicenter of the COVID-19. That time, people are very scared. They don't know where to find help. They don't know whom to talk. They cannot visit the doctors. ER is filled with a lot of COVID patients. So what they saw, they call us. We have the hotline. We have phone lines. Anytime they can call. We've been receiving like 30, 40 calls for each nurses, and we've been telling them what needs to be done. We also provided some basic medical supplies to the community in New York. So we had donors from outside of New York who've been donating all these medical supplies. At the end, we are able to distribute that in the Tibetan community in the New York. and New Jersey area. And also we are able to save a couple of lives as well. I'm not lying that. We are able to send patients to the hospital when they actually need it. Tibetan community in New York itself, they're very, very happy with what Tibetan nurses did. As also Tibetan Nurses Association or the health promotion community in California does the same thing. So we've been doing a couple of interesting things, and we are trying to best help our community.
That's wonderful, Pamela. And thank you so much, Pamela, for giving us more information about the Tibetan nurses coming to India. And Pamela, for the past couple of weeks, I have been interviewing Tibetans who are involved with the COVID-19 relief. And it feels so glad to see that Tibetans from different parts of the world are doing everything in their capacity to help fight the pandemic. Thank you so much, Pamela, for speaking to us, and thank you for giving us your time.
Thank you, Sakina, and thank you, Tibettv. And we are coming, and help is coming to India. Very excited.
Thank you, Pamela, and so looking forward to see that. Thank you so much for watching, and see you in the next episode of In Conversation with Tibettv.